You just spend a couple of months, couple of years, 1 or 2 or even more, wearing the famous braces, and you're looking to have a perfect alignment on your teeth. You're wearing probably, if it's not this type of braces, you're wearing Invisalign. And now you go to the mirror because it's the first appointment where they're gonna remove everything now because you're finished. And then you look at the mirror and you said, oh my God, my smile is perfect, stunning. It looks beautiful, gorgeous, I love it. And then you step out of the dentist, your orthodontist, and then you go home and you think nothing else to do. Now, few years later, 1 or 2, you go back to the mirror one day and you look and your whole teeth that they were aligned perfectly, now they are all crooked. You are questioning yourself, oh my God, what I'm gonna do? What is the answer? Why is this happening to me? Hello everyone, I'm Dr. Fanny Yacaman, and today we're going to talk about the most important part of orthodontic specialist, but also the most neglected area, which is the face of the retainer face. What is the meaning of the retainer face? The retainer face meaning that after your orthodontic treatment, you have to wear a retainer. Today, we're going to talk about what are the different types of retainers, why these retainers are like the bodyguards, are the bodyguards of this completely reconstruction alignment that your orthodontist went through all this time, and for how long we're gonna use it. If the mouth are an architect, the teeth are holding the mouth to be in exactly certain position, and you don't keep them in place, why this shifting is happening. We're gonna talk about why this happened, how many retainers we have, and how long we have to wear them. During our entire life, our teeth and our bone are during physiological changes. What is the meaning that every time we are talking, every time we're biting, when we swallow, when we speak, the teeth start in constant movement. Our physiological bone start in constant movement. And that happens as we age also. It becomes more movements and the teeth start shifting when they're not keeping place. So if we have a retainer, in this case this is a little stronger because this is an eye guard, but the retainer, what it's gonna do is keep the teeth in the position that they were planned to be moved. That means that if these teeth were moving this way, they have to stay with this retainer at night in the same position because the teeth are gonna be in constant movement. Our teeth tends to start moving forward. And if we don't keep a retainer, then this movement is gonna take the path of least resistance. The teeth are gonna start moving and shifting, and they're gonna look with the genetic information they have inside, they're gonna move to the place that they were seated before. That is the reason why the teeth have to keep a retainer at night. And we're gonna talk about the different ones of how long you're gonna wear them. Let's talk about your two bodyguards, meaning your retainers. How do we stop the teeth from migrating and getting crooked again and start going back to the place they were before our Invisalign treatment? How do we do that? We have two different main options. One is the fixed option, where if the camera can take it, this amazing retainers, it's a fixed retainer. Amanda designed it here just for the teaching purpose, and we can place it, the orthodontic doctor will place it and get it fixed, or nowadays we have many dentists doing Invisalign, and then we place this fixed retainer. This retainer has a huge advantage. Why? Because it's fixed, it's right there, usually it's from canine to canine, or the eye tooth to the eye tooth, that's how they call it in America. It can be on the upper or the lower, or maybe you need it on the upper part that we don't have any, or on the lower. And what happens with this retainer is that it will keep your anterior teeth in place, because that's the main ones that you wanted to keep in that place. And the biggest disadvantage is that you really need to have an excellent hygiene when you are having this fix. Why? Because you need to use a super floss. We have a technique that you can look at on the channel, and it's how do I brush my teeth when I have braces. The same happen when you have a retainer like this. And why do I mean with that? Because you have to go here and pull it, and then go to one side. You can have it, I don't know if you can capture it here, but you can have it in one side and then the other. And then with this spongy, it's gonna come all the food in between the teeth. Or you can use a different one with the floss. You have a threader that if you have a regular floss, you don't need a specific super floss or anything, can be any type of floss. It can be the regular, the skinny one. And then you enter the floss in here like a needle. To me, when I have braces, this was the easier. And then you go, just like if you have braces, you place it here, and then you can bring it easier. Patients have easy way to do it. And again, you hug the tooth in one side, the other, and then you work like if you're scooping out the tooth. Again, watch the episode we have, how do you clean your teeth when you are using braces. Now, this is the best retainer because it's 24/7. And then remember, you need to have a very good hygiene, that's all. So it's easy to remember that. Let's talk about the other bodyguard. Why do I call it bodyguard? Because these are gonna be the guarding angels to protect that all the work that you did in your mouth is gonna be protected by these retainers, that they can keep your teeth in the same beautiful place that you want it to be from the very beginning. So the retainer that is fixed, it's very similar. I don't have it with me because we don't do orthodontic treatments here, but it's very similar to the famous Nigar that I talked so many times. The Nigar is very strong. However, and the Nigar that we use a very strong, or Dr. Vijak, I don't take it, I don't do Nigars, but then he uses a very strong material, versus when you have a retainer, the material they use is very soft. It's a little bit stronger than a bleaching tray for whitening your teeth. This one, for the soft retainer, it's the different material, it is softer. And the advantage of the removable retainer is that you can easily remove it, go to brush your teeth, and then floss, whatever you need to do. There are some times that the name of these retainers, removable, they're called excess, and they are specific for orthodontic treatment to keep the teeth in place. They have to make to fit in your own teeth. Obviously, the dentist, the orthodontist who did your Invisalign or your treatment is the one who's gonna make your retainers. Now, the advantage is, I told you, you can clean very easy, brush and floss. If you have to wear it during the day and you're in a place, then you can remove it, brush, and then place them back if that's what your orthodontic doctors say. Or in the night, you're gonna wear them for the night, and in the morning you can brush and floss, the regular way. Now, what is the biggest disadvantage of this? That it requires that you keep it very clean. Some patients that I have seen that I said, bring me your retainers, I see them, they're so dirty because they don't clean them, they just rinse it, and that is not enough. There are different ways to do it. I personally brush my night guard, or well, now I have to use a snore guard. I don't think I snore, but supposedly I snore. That one you have to really brush it very well. I use a toothpaste, and then these are really good denture effervescent tablets where you can get it out, take it, place it in a huge container that I have, or a big glass with water, and place the tablet after you wash it all day. So at night, you're gonna have your retainers as clean as they were new, because the mouth is full of bacteria. And if we don't keep a clean retainer, and imagine the whole night you're wearing it, bacteria gets in there. Then the next day you just rinse and prender, then start having a really bad odor, like something is going bad, food is going bad, because it's a breakdown of bacteria. Or you can also create a worse type of environment with bacteria in your mouth. So it's really important that you keep in mind that this is easier, but again, you have to have it extremely clean all the time.
Wow.
And now it comes to the typical question: for how long I have to wear these retainers? Whether it's fixed or removable, this is painful what I am gonna tell you, but if you wanted to protect your alignment of your teeth, your beautiful smile, and you wanna keep all that investment, the time, the tears, and especially that you are so happy to see that your smile is really nice and it makes you feel better, then you have to wear the retainers, unfortunately, for the rest of your life. The minute that you stop wearing these retainers, there is gonna be a problem. The big advantages of the fixed ones is 24/7, you have it them. Remember this, you have to go to your dentist every 6 months, or if you want, every year. But if you feel anything is not fitting, or this is getting tighter, that means you stop wearing it. The dentist has to check what is the problem, because you cannot wear them if you start hurting. And the fixed one, you just have to be sure the wire is stable. That way, you are gonna keep all this investment for the rest of your life. If this episode has something to do with any similarities that you have in your dental treatment, if you have orthodontic treatment, if you have Invisalign, if you have a family that has gone through all of this and have all these questions, be sure to press a like button and watch the episode as many times you need, so you can follow a successful treatment and keep your smile as beautiful as your dentist want you to be, and you want it to feel better, and you're gonna have a more functional bite. Thank you, and we'll see you soon.